I don't see Paula yet, but
I'm here. I've been here.
there you go. All right.
Hi, Paula.
Hi, how are you? One of these days, I called to troubleshoot the screen. They said to try to cancel the program and like reload it, and then I didn't get to do it. So apologize for being behind the screen still.
No worries. Just on the list, over on the side, there's the list of names of people who've registered, and there you are. Your microphone is all lit. Beautiful. So 6 o'clock. Call this meeting to order. I suppose we should do roll call. I'm Brian Green.
Paula Machado.
And Robert Sixia.
Okay. So Karen, you said you would like to introduce deputies, so let's do that.
That would be great. I just wanted to have a chance for you guys to meet Kelly Highland, our new Deputy Director of Public Health. Kelly started, what, a month or two ago now? It's flying by, but yeah. And Kelly is a nurse by training, but has done lots of work in public health emergency preparedness, homeless coalitions, has a wide variety of experience that she's bringing to the team, and has done some great work in the very short time she's been here. So just wanted you guys to have a face with a name, and so you know, and she knows you, and she'll be back to talk with the board, I'm sure, on other issues as we move forward. Kelly, anything you wanted to add? Or, oops, you're on mute.
Oh, can you hear me now?
Yeah, you're very soft, but we can hear you.
Oh, okay, sorry. I'm new to this GoToWebinar. It's so confusing. Yeah, so it was just nice to meet you all. Like Karen said, I'm a nurse by training. Came from the city of Gloucester I was there for over 6 years as their public health nurse, and then a short stint on their board there in Gloucester. So I'm familiar from all angles of public health. But I'm excited. I've been learning about the team and how I can help, just really help reduce our health disparities at the root cause. That's really where my passion lies, as well as making more streamlined, efficient processes internally within the department too, because we all know we have limited resources here. So it's nice to meet you all, and I appreciate you letting me jump ahead on the agenda so that I can scoot off to the Food Coalition meeting. So, well, thank you.
Thank you. Thanks for joining us.
Thanks, Kelly.
Yeah, great to meet you, Kelly. Thanks for joining.
Yeah, welcome.
All right, we'll let you scoot. All right, and then I think the next item on the agenda is approval of the amended November minutes.
I second it.
All in favor?
Aye.
That's all three of us, unanimous. Next item on the agenda is Bonnie Carroll. Welcome back.
Hi, Dr. Green, and hi, Robert and Paula. Nice to see you again. I'm sure you can't see me because I can't see you, but maybe you can see me.
I see you. Yeah.
You can?
We can see you,
Oh,
yeah.
Okay, I can't see any of you, but okay, thank you. I just wanted to come and speak to you about changing some of the language in the smoke-free workplace law. And one of the TA lawyers from MTCP is intending to be here. I don't know if she's here yet or not. Lisa, are you here?
How do I? Oh, yes, I am. Sorry, my name was as Bonnie Carroll when I first logged on. I didn't realize that. But I'm Lisa Stevens. Good night. I'm with the Mass Municipal Association, and I provide technical assistance on tobacco control regulations.
So Lisa has an update to the language that we'd like the board to adopt if they're willing. Lisa, do you want to explain some of what the change is?
So correct me if I'm wrong, because I'm taking Cheryl, who was originally working on this with Bonnie, wasn't able to be here tonight. So I just want to make sure that what I have written down from her is correct. But you guys, this is about trying to amend the language a little bit so that you're able to open safe consumption sites. Is that correct?
Yes.
Yes. Okay. So
Yeah.
right now,
Lisa, just to clarify,
Yes.
yeah, I mean, that's part of it. It's amending the language so that the board and the department have some options around harm reduction services. Sometimes, you know, obviously our preference is smoke-free environments all the time, but sometimes in the harm reduction world, it's a strategy to allow some smoking or smoking in some spaces so that we can get people the help they need. So just to clarify, yeah. Thank
okay,
you.
yeah. So right. So that is totally doable. The problem right now with your workplace smoke-free workplace laws or regulations is that you use the older definition for smoking, which includes non-tobacco products, which that gets it's obviously a much broader range of products. The state actually updated their definition when they allowed social consumption sites, but the new language would allow for what you guys are trying to do as well. So that's just, would just be changing your language from the older definition to the newer definition in the state regulation, in the state law, would allow you to provide services to people who wanted to smoke. It would still prevent the, smoking tobacco indoors, which is shown to have, pretty substantial health impacts, while providing kind of that safe space for people to use other products inside in that safe consumption site, is my understanding.
So sounds to me like there's two separate questions. One thing is if people want to smoke cannabis or heroin or I don't know, whatever in a safe consumption site, would it be, if we adopt the older language, then that would be allowed. What I thought we were asking, or I thought the board was asking about, was if somebody who has an addiction to whatever and is coming into a safe site to use that and won't come in unless they can also smoke cigarettes, would they be allowed to smoke cigarettes in that space? Am I right about that, Karen?
I don't know that we teased out exactly what products would be smoked. I think that it could be a range of substances that we're talking about in this, but maybe for the tobacco regs, we are strictly talking about tobacco. Is that correct, Lisa and Bonnie, that we're only talking about tobacco in these regs, or are you saying that the state has gone to a broader definition to include other substances?
No. So actually, your current regulations are narrower and broader. So they encompass more products than just tobacco. So you would be in violation of the smoke-free workplace regulations in Somerville if you used any products indoors. What the tweak would be, and what the state did, is that they actually kind of tightened the definition to just apply to tobacco, which is, so again, like one of the reasons that it's focused on tobacco, but still really that emphasis is there, is because the health impacts, not just for people who are smoking, but for the people who are providing support. And I'm not an expert on safe consumption sites, but I do believe one of the things is that you have people there who are able to provide services if people want them. And so you don't want them to be exposed to the secondhand smoke as well, because there's a lot of very detrimental health impacts for that. But it would allow people to say, like, use other products in that space if that was the drug that they were, trying to use safely.
Right. So I think for the specific if we were talking specifically about a future potential supervised consumption site, that this change would allow for the use of smoking of other products or other drugs in that facility, which would be part of what safe consumption sites offer. So I think that that would cover off on that. The second part of this is back to the more general, what Dr. Green was talking about and what I talked about in the beginning, where sometimes with harm reduction services, we want to allow people to smoke cigarettes as well. But I think maybe that has got to be dealt with a little bit separately than from what I'm hearing from you. Is that correct? That's going to be a bit more challenging.
Yeah, I mean, I think if you wanted to provide, so there are people with MTC, with the Massachusetts Tobacco Control Program, that actually specialize in how to do like harm reduction with tobacco, so like, and tobacco and substance abuse issues with tobacco. So I can reach out to one of them and touch base on how to do that, but that would be more complicated. And I would maybe recommend against kind of like, you don't want to end up throwing out the baby with the bathwater, and making it so that there's, you know, you don't have strong workplace or smoke-free workplace rules in an effort to kind of like I wouldn't want you to overcorrect and end up with rules that aren't providing protection to workers at like restaurants and things like that. So yeah, so I can reach out to someone and because I do know that like MTCP, there are people that work specifically on how to provide like effective care, including access to tobacco, you know, cessation and not having them interact, but it's not really my area of expertise as much.
And I guess the other question is, let's say we're talking about cannabis exclusively, just to make this simple. If we make the change that you're talking about for workplaces, then does that suddenly allow cannabis in bars and restaurants? And
so the rules around that's a social consumption site is what they're called. And so the change was made so that the smoke-free workplace laws wouldn't be in direct conflict with allowing social consumption, but it's not as if you open up that part, if you change this definition, suddenly they can open up unregulated social consumption sites. My understanding is that that's like a different vote, and you have to work with the Cannabis Control Commission in order to open one of those. But it wouldn't just kind of create like a free for all of like everybody can use other products in other retail establishments.
Correct.
Okay, so this would then kind of just narrowly, modify this definition so that, these kind of safe consumption sites can, not violate workplace laws for any of the smoking that's done there. Caveat, cigarettes may have to be looked at, but this wouldn't open the doors for someone using those other products at a bar or restaurant. Okay. And then
Correct.
sounds like there's still another caveat for, cannabis use, for social consumption. That's great. So.
Yes, that's my understanding, and I can verify that with Cheryl, because smoke-free workplace rules are a little bit more her wheelhouse. But that is my understanding, that it wouldn't open. So if you want to use marijuana like in a bar, it has to be at a social consumption site. You can't just go under the state laws, so that you would have to have an established place. I'm not saying it doesn't happen, but it wouldn't be like allowed to happen.
there's bars, and then there's banks, and hospitals where people used to smoke.
Yeah. I was recently in Tennessee where they do still smoke inside, and it's very interesting reminder.
Banks and hospitals, yeah.
Yep.
That's crazy.
Paula, you're not quite old enough to have remembered the ashtrays at the nurses' stations. But they used to have them at every nurses' station.
I mean, I remember them in cars, and that was horrifying. Not that.
Uh-huh.
Paula, I'll tell you a story about in the days when I was having my children, and the doctors were now suggesting that we use breast milk rather than formula. You can see how old that is, but because breast milk is healthier than formula. So there we were, 4 mothers in the maternity ward smoking while we were breastfeeding our babies.
And the babies are totally fine.
Yep.
That's wild.
Totally fine. They provided ashtrays on your tray. Yep.
Lighters too, or?
No, just ashtrays. Had to get your own lighter. But yeah,
Jesus.
I know.
All right, so to bring us back to the agenda.
Yes.
So
Sorry.
I think this wasn't a question about voting. This was just bringing us. I think the question was around these safe consumption sites. Did we have to consider legislation? But we're not proposing legislation today. Am I right about that? This is just informational.
I mean, that's up to you. That's up to the board whether or not you want to adopt this change at this point, or whether you want to consider it further. There's certainly no, imminent hurry that it needs to be done this month. But I think what Bonnie has kind of said to me and what I've heard from Lisa tonight is that it would be moving to the more updated regs that the state and language that the state's using anyway. And then it potentially gives us more options in the future. So
Yeah.
it's up to the board.
Bonnie and Lisa, you guys feel that you needed to look at those other 2 issues that were flagged, in terms of, tobacco or cannabis, or did you guys feel comfortable and you'd recommend that we move forward with just, going with this adoption? I mean, like, I haven't seen the language in front of us, but, I'd kind of rely on your judgment if this is something like we need more scrutiny on, and that's what you need, or you feel like very comfortable, because in concept, this makes sense to me. And I'd support it, but I'd rely on you if like you wanted us to dig in or you needed this to take back. So that's my thinking.
I mean, I guess I am a little. I would love to see the language before we voted on it. So if there's a thing, I think I would bring it back. But I guess I'm a little puzzled about the fact that we're kind of talking in generalities, and sometimes we're talking about cannabis, and sometimes we're not talking about cannabis. So like,
I would like more like specifics on that with the language myself. I'm still not. I understand what you proposed, but some stuff I'm still unsure of.
Are we talking about people smoking crack and methamphetamines, and like, what are we talking about?
It's just in general, yeah, I guess. I mean, people can do whatever they want. We won't know until people start doing it, right?
Well, again,
So, yeah, I mean, I can just tell you where we're at with that process. The supervised consumption site recommendations from Fenway, they did the report, and they put forward a recommendation that is being considered by the city to open one of these sites, of which part of the facility design that they have suggested that we put, as part of the RFP for building this thing, is an area of the consumption site that is for smoking of various products. Now the whole, this is not your normal bar, cannabis or otherwise. So this is a complicated, as you know, issue. And so so all this does is just takes away one part of it, one barrier from the tobacco side, from the tobacco regulation side. It wouldn't hinder the opening, but the opening and the use of a wide range of drugs that in a facility like a supervised consumption site is a whole nother process and decision that the city would need to make and is in the process of reviewing. And so I mean, there is no supervised consumption site in front of us now that we have to say, but we are in the process of exploring this and following through on the recommendations of Fenway's report, which is to begin to think about what sites might work and what would be in that site, and developing an RFP to go out. So,
So the only thing I was going to say was that I'm very comfortable with the idea that a supervised consumption site is going to be involved with people using substances that we consider not fabulous for one's health, right? That's the point. So I'm not, I get that we're trying to do harm reduction, and I think also Lisa brought up the issue that we're talking about a workplace where people have to be. And so if people want to, if people are going to do something and we can find a way to reduce the harm for those people, that's terrific. But if we're going to have to staff that place and expose other people to the risks, then what we really need is a ventilation. So I know one of these times you talked about, sort of a cone where people could smoke in and would ventilate out. And for me, that we're kind of going around this in a circle. I have no concerns about what people do inside the cone if the whole point is that they're doing it inside the cone so that we can supervise what they're doing in a way that makes it safe. I am concerned about the workplace.
yes, and that would be one of the requirements, is that there was a separate designated area with negative pressure or whatever, so that the ventilation is circulating out. But again, that's not a definite thing we know and can evaluate, because it would be part of someone's bid to operate this site. Paula, did you want to say something?
No.
So if I understand it, if we update the language of the regulations to what the state currently has instead of our own, then we're not really, I don't know how this reflects to all workplaces versus the safe consumption sites. Are we making a carve out for safe consumption sites, or are we making an update to the language for all workplace smoking?
This would be an update to all workplace smoking because it would apply to all of them. Again, the issue of cannabis consumption in workplaces is not one I'm as well versed in, unfortunately. So I can't tell you exactly what the impact would be there. But right now, as it stands, you would not be able to open a safe consumption site, in part because, and I'm sure there's other hoops, because I've been, before boards of health that are also considering this type of harm reduction method, and there are many kind of barriers and hoops to jump through before it seems like they can be established. But one of them that I think we don't want to exist from our point of view, because we do a lot of harm reduction as well, is we don't want the workplace smoking rules to be so broad that we're preventing people from getting services that they need to stop using other, or to safely use other drugs. If I'm that again. So right now you wouldn't be able to open one because it would be in violation of the smoke-free workplace ordinance or regulation in order to allow people to smoke other products inside. If you change this so it just focuses on tobacco, it wouldn't be, it wouldn't allow smoking in other places. It just would say that it would remove the barrier.
So the reason I guess I'm worried about that is because, having been on this board for a long time, there's all this stuff that was like, what are we calling about vaping? What are we calling about vaping nicotine? And so whenever we try and narrow the definition of nicotine-based products to tobacco, the very powerful industry that's trying to get people addicted to nicotine finds ways around that. And so part of the reason we went with a broad definition in the first place was to try and compete with this thing. So I don't love the idea of collapsing the definition of workplace safety if I'm not sure what we're limiting to.
Right. No, and I totally understand. Actually, so I'm looking at them, and this is a little bit unfair because I don't know how to put it in the chat or to share it with you guys. But the state definition very much incorporates vaporized and aerosolized products. It was updated. I don't know, off the top of my head, I'm going to say 2019, but that's wrong. But it was updated after the emergence of like Juul and those other products. So it very much takes into account what your concern would be, is that it would not allow, you would not accidentally be allowing vaporized products to be used indoors as well. So
I think it might be useful to see that, the change, and let the board have a chance. I mean, I'm not the chair, but sounds like it might be clearer if we had the proposed changes in writing through this. It's just a suggestion.
Yeah.
Especially because there's no urgency to do this. I think it'd be nice to see it, make sure we knew what we were doing.
yeah, and I mean, I think that this is something that's like, it is really important to provide or to like explore these other alternatives. And we don't want, like, again, we don't want one type of public health, regulation to like get in the way of another good public health regulation. So I can get them over to you guys, and we can, it may be possible, it may be, that you do need special language or want special language, and that could be something that we could probably work to help you guys work with as well. Is that okay, Bonnie?
Yes. Mm-hmm.
Bonnie, do you have anything to add?
No, I'm sorry. No, I'm sorry that I didn't already give you the language change in, so that you could see it, but we definitely can get that to you.
Okay.
Mm-hmm.
Paula, Robert, anything?
No, I think, yeah, we can take a look at it and see if there's any issues. If there's no rush, yeah, we'll see you guys, I guess. Yeah, send us the reg language and we'll look at it and have any comments for the next meeting. Yeah, that's fine.
Yeah, that's what I had said too.
All right, great. Thank you, guys.
Thank you, Lisa. Thank you, Bonnie.
Thanks, Karen. Okay. Good night.
Good night.
Right.
All right, next on the agenda is Council on Aging.
Yep. Ashley, here's Ashley. All right, I'm going to try to share my screen now with you all. Are you able to see the slide on the Council on Aging?
Yes.
Yes.
Sure. Fantastic. Okay. Ashley, I'll turn it over to you.
Great. Well, thank you for having me here this evening. It's great to meet you all. My name's Ashley Spiliotis. I'm the director of the Council on Aging for the past 2 years or so, right when COVID hit in July 2020, so maybe not right at the beginning. I took over for a long-term director within the city, but prior to that, I was one of the social workers at the Council on Aging, and prior to that, I was a social worker in a community hospital on the North Shore. So really focusing on crisis intervention, significant changes of people, seniors, coming to the hospital well and not being able to return home, or the death of a spouse or loved one, and seeing just the devastating effects that can have. So when I transitioned to the Council on Aging, it was really a chance to work on prevention and to meet people where they were at in the beginning stages of needing services for the most part. So it's been a very exciting opportunity to work with the Council on Aging, and I'm happy to be here tonight to give you a little bit of an overview of what we do and our mission. And I put a couple slides up there because it is an overview, but really so you can see some pictures of our great work, because these are all of our seniors doing amazing things out in the community. We're a multidisciplinary team where we believe that every older adult has the right to access programming and benefits that enhance their lives and maintain their independence within the community. And we really work to remove the barriers that prevent older adults from living well and accessing services. So our team consists of health and wellness focused individuals. We have a health and wellness coordinator. She coordinates all of our fitness programs. She runs general exercise programs and then puts on educational events geared towards health and wellness, of course. And she works with our nutritionist who runs general nutrition programs, but also one-on-one nutrition counseling, all free for service. We don't charge anybody's insurance. It's very, very minimal fee for some programs if there's food involved, actually. That's really the only thing we charge for at the Council on Aging. So we have also social and cultural programming. This is done with our outreach worker and our program coordinator. They bring events to the center like multicultural music performances. We have a magician coming in January, our holiday parties. They are in charge of programming to decrease isolation, increase socialization, get people while they're well to our centers to connect with our other staff members for maybe when they're not so well, specifically our social workers. We do individual crisis management. We don't do long-term counseling, but we make referrals and connections for long-term counseling. We do a lot of case management work. So connections to our food pantry. We run a food pantry on our own, but we connect to a little bit more intensive food pantries. And we also do applications for food stamps, mass health applications. They do their certified SHINE counselors, so they do a lot of work during this open enrollment time to get people appropriately on Part D plans, and also to make sure their health insurance benefits are what they need at the time. So I know Karen flipped over the slides, but if you go back, Karen, I was just going to point out some of our photos. We have arts and crafts there. Or one of the pictures down on the side is we partner a lot with outside agencies. We partner with the Mystic Learning Center and their kids program to do intergenerational events. So over the summer, they taught us some card games, and then they came and we showed them how to play bingo. We have some seniors they're learning salsa dancing down there, but they also do line dancing, healthy steps. And then we also work with flatbreads a lot. They allow our seniors to go bowling during the week. And then we have a drumming performance in the corner. So that's a few of our varied programs. And if you flip over to the next slide.
Wait, can you explain Grooversity?
Grooversity is a program. It's one of the high school music teachers' actual program. It's a band of drummers, and they teach kids and seniors how to drum, but they also set up equipment where you travel across the world and you drum like Latin drumming in Latin America, or you go to Greece and do like different cultural drumming. So it's kind of a hoot for the seniors to see what happens using technology and the arts. So that was a good one we had. On this page, on this slide, we have some of our summer food security programs. We, during the pandemic and continuing on, have gone quite a focus on lunch handouts and prepackaged food handouts, where we connected a lot with Meals on Wheels. And then we do different ice cream socials. We had some games at our mayor picnic, and then we had a lot of outdoor events. So for our food security, in addition to our to-go meals, we have lunch at a center every day, whether it's to-go version or a hot meal, a hot sit-down meal. It's every Tuesday and Thursdays is our hot community meals, and then additional meals based on our activities. And we have a food pantry, a shelf-stable program, which was actually this morning, where we give out 40-pound boxes of canned goods,
a few fruits and vegetables, but that's where the connection to other resources come in. If people are dependent or need help with fresh produce and meats and cheeses, then we make that connection for them. And last but not least, we have our senior taxi program. It also came about during the pandemic with grant funding. We are able to provide seniors over the age of 60 free taxi rides to routine medical appointments, the grocery store in Somerville, and to pharmacy. It came about, like I said, during the pandemic to reduce the barrier of transportation to getting to our medical appointments, our pharmacies, reduce the worry people were having of using public transportation, or as you folks know, as people get older, sometimes it's harder to drive, or many of our seniors have never driven living in the city. So it has been a very, very successful program, and we have now been awarded some ARPA funding to keep our program going through at least March and hopefully beyond. So we have 2 centers listed down there and our contact information. If you have any seniors you'd like to refer or think would be a good fit to us, please do reach out. But that's the Council on Aging in a nutshell, and I'd love to answer any questions if you have any.
Yeah, I think just great to meet you Ashley, and hear about the Council on Aging. I think, it sounds like you guys do wonderful work. So just would like to hear maybe about what your vision is going forward, right? It sounds like you've got some money. Is this kind of like you looking to continue, or are you looking to fill certain gaps or needs that just haven't been addressed? So yeah, what are you thinking about the future?
Sure. So our immediate need actually is we are looking for one more geriatric social worker. So tell all your friends and colleagues maybe that we have a great spot on our team opened up. But to answer your larger question, even before the pandemic, we were seeing, and much so after the pandemic, we're seeing a shift in generational ideas of what a senior center is and what community resources mean. And so what I mean by that is, prior to the pandemic, we really saw the Somerville senior community wanting a place to hang out and to come for the day and socialize with their friends and neighbors who they've known for years, and their kids grew up together, and just having a cup of coffee was enough for them. And post-pandemic, and even a little bit before, we see that seniors would like to come for a service. They want to come for a exercise class, exercise, and go home. They want to come for a educational event and then maybe not come back for a few years. So we are really focusing on having that multidisciplinary approach, a varied, always changing programming of fitness and education, and really getting people cycling in and out, and hoping that they stick and stay with us for seeing one program and then coming back the next day for something maybe they didn't even think they were interested in, and then find out that they love.
Well, great. I hope you're able to find staff. I know it's tricky hiring everywhere right now, but yes. I hope you get someone good, and yeah, great to hear about your long-term thoughts.
Yeah, great. Thank you.
I also wanted to just add that in terms of where we're other future planning and working together, Ashley and her team and the nursing team, as well as our other partner agencies in the city that kind of serve our senior population, are working together to make sure that we're offering a wide range of vaccines, and that they're in the spaces where people need them, they're accessible. We're very worried about the high rates of hospitalization with this population illness, low rates of the uptake of the new vaccine. So there's been a real concern. Ashley is making it along, and it's fantastic. So thank you very much, Ashley, for joining us tonight, and that great overview of all some of your fantastic programs.
No problem. Have a great night.
Yeah, thank you, Ashley.
Thank you very much.
Thank you.
All right, that brings us to the everyone's perennial favorite, COVID and respiratory illness section of the evening.
Yeah, so I've expanded that agenda item to, broaden it to other topics. I just wanted to highlight that the Somerset Department has created a new dashboard that is at the request of our team, and it's fantastic. And I believe they went live with it on their city website this week. But it's a little bit broader than just COVID, so it looks at the wastewater COVID numbers, which is useful. It also looks at the hospital occupancy rates in the area, as well as the hospitalization for 60 plus. That is really at the age group we're most worried about right now and are focusing on. And also they've added flu. So as you probably all know, the flu has spiked very early this year. I think that's the thing that's sort of different and worrisome to us, that coupled with COVID and RSV and other respiratory things, to see such a spike in flu so early in the season is concerning. So we're watching that, and our friends at Somerset are keeping that dashboard up to date. We are also doing some more outreach with the communications department with Denise Taylor. She's going to be pushing out messages this week and next around holidays, gathering, and the primary message being vaccinate. So we will see how all of that goes, and hope that things, stay kind of leveling out or go down and the flu goes down. I mentioned the work with the senior population, additional clinics there throughout the city. And also we have started our Wednesday afternoon drop-in here at the annex. So the public health nursing team are offering COVID and flu. It was first week was this week with small numbers, but still folks came through. So we'll continue to advertise that. Yeah, I mean, I think those are kind of the main things I wanted to highlight.
Thank you.
Yeah.
I'm not sure I have much to add.
I know.
Same.
The state, I don't know if I mentioned this last time, but the state has promised us very soon that we will be getting some data on the numbers by age, by race, but broken out a lot of different ways for the COVID, for the new booster. So that will be helpful if we can know who has received the new bivalent booster, and not just, right now you kind of see that someone had 2+ boosters and we don't know how recent or which one. So we should be getting some data soon on that.
Is that for outreach to like high risk individuals, or is that just for our own like kind of high level understanding of trends?
I think both. I mean, they're going to do it for everyone. I don't think they're doing it just for us, although we've been asking a lot. They're going to expand their COVID dashboard on mass.gov to more specifically tease out the newer booster and give us information on just that. So I'll know more when we see it, and hopefully this month we'll have access to that and see how useful it is. Yeah.
All right. Paul, anything you want to add before we move on to Health and Human Services Department?
No.
All right. Health and Human Services.
All right, I'm going to keep this brief because we've had a lot of presentations tonight. And in January, I'm going to bring our goals and an update on our goals, which will give you a nice overview of a lot of activity. So a few highlights. Last night, there was the Veterans Holiday Dinner event that went very well. About 100 people attended that at MGB. We are also getting very close, or the Somerville Homeless Coalition is getting very close to opening their doors more widely for their engagement center, which is very excited. It's an ARPA funded, the city's using ARPA funds to support that initiative just in time for the cold weather. It will not be really a warming center because it's not going to operate, 7 days a week, but it's a start, and it's another space in Davis Square with a whole lot of resources. And they've been sending pictures as it's coming together of beautiful couches and lockers and other things for persons experiencing homelessness. So we are excited. We are partnering with them for providing backpacks with sleeping bags, warm items, Narcan, whatever items they need. And then there also is a smaller subgroup working with our emergency preparedness coordinator, our emergency manager, Justin Cates, around what to do in extreme weather conditions. So we're really up against the clock. We're working really hard with our partners at Somerville Homeless Coalition to find some ways that we can extend hours of the overnight shelters, or partner with other organizations or the city's team. So I think we are close to having a few solutions there to at least get us through some of the coldest weather this winter, which is a concern, but we're making a little progress there. And then finally, two of myself and Kelly Highland went with 3 members of the police, a dispatch, the mayor, and the mayor's executive assistant. We went to New York City to visit On Point, the supervised consumption site there, and saw the range of services that they offer, which was really fantastic to see such a large model where there were built, right on site, so many services, clinic, doctors, pharmacy, food, nutrition, laundry, showers, you name it, social work. So that was fascinating, and we learned a lot, and that will inform our moving forward. Those are some of the biggies. Oh, and one other thing, we had our first all in-person staff meeting in a very long time. Certainly my first as a director, about a couple of weeks ago at the Council on Aging building. We had a fantastic breakfast. The energy is great, and I would love to get the board to join us, maybe at one of our future all staff meetings. The team is fantastic, and they are excited to be getting back into a little more normal work and excited to get to know each other. It was also very interesting for me to realize we kind of raised hands and how long people have been here. And I would say a third to maybe a half of our staff have been here less than a year. So we have a very new team finding their way, but it's a fantastic team. So it was a good event, and I think definitely important to do at least quarterly with the team. So those are a few highlights. Certainly, if there are specific questions, let me know, but I didn't want to go on too much with, given we've had a pretty full agenda.
Yeah, no, happy to, kind of attend any, meetings that you kind of would like the board to show up to, or, and I think it helps foster personal connections, which have been difficult when we're just meeting on screens all the time. So yeah, let me know. Give me like a week or two in advance. I think I should be able to do stuff. And then, yeah, on the, your trip to New York, any observations or thoughts or surprises that you took away from that trip?
I think the biggest one for me was the level of involvement of the New York State Department of Public Health. They are financing, they are active supporters, they have brought NYU to the table for the evaluation of the site, and they're funding all of the support services around a supervised consumption site. So they don't actually fund that part of the program On Point, but they fund a lot of wraparound and support services. So I think that that was really interesting, and I think that their support is really important, and I would love for our colleagues at Massachusetts to be able to be involved in our harm reduction work as well. So
What is, what is DPH's kind of interest or involvement right now? Is it still too early, or are they initially interested? Yeah.
You know, we're not really sure exactly because we haven't had these conversations with them, but we are reaching out to the BSAS unit and some of the other units that have been doing lots of harm reduction work, and to start some conversations and to get TA from them to see where DPH is at, what their level of involvement or support, just to kind of open up the dialogue. So we are going to request, just discussing it, and at Nikki's suggestion, we're going to reach out to them. And you know, they have a lot of changes with new administration as well. So
yeah, coming soon, right?
yes, yes. So we will see how that goes. We'll keep you posted.
Thank you, Karen.
Yeah.
I was muted, but now I'm good. Look, Paul, did you have something you wanted to add?
No, I was just gonna say no one's talking. I don't know. I thought I was missing something.
I was talking to a muted microphone.
Oh yeah. Okay. I wasn't seeing things then.
All right, thank you. That's all very interesting stuff. I again don't have much to add. So the next item on the agenda is next meeting, January 12th.
All right. 12th to 19th.
Yeah, that doesn't sound right. It sounds a little early. It's the third Thursday, so that
19th.
That's fine. Yeah, 19th is okay with me.
Let me look at a calendar just a second.
All right.
I think I already looked at this, but now I have to think about
it. It would be the 19th. Would be the third Thursday.
I think I'm going to be out of town on that one, on the 19th.
Okay. I mean, I can do the 12th also, or the 26th. Both are open. I'm going to be here and cold, so.
I think the 12th was an error on the screen, but actually it works out for me. But I don't know, Paula, you're the one who usually has the hardest schedule to change.
No, I usually. Oh, I know I am. I'll just. That schedule isn't out yet, so it's fine. I'll just put it in.
Okay.
The
So
26th. Oh wait, we're doing the 12th. Okay.
Well, Brian, which one? 12th or 26th?
I think for me the 12th is better.
All right. Give me 1 second then, because that schedule's out.
Let me run to another calendar. Just a second. I'm going to turn off my camera. I'll be right back.
Yeah, that's fine.
Okay. Yeah, so whatever works for Brian works for us, sounds like. Okay.
All right, so I in fact booked flights from Wednesday to Wednesday, so I will be back the 19th. So actually the 19th was what I originally planned for. So yes, that's what I'm doing. So
All right, the
let's keep
19th it is.
Stay with the 19th.
19?
Got it.
All right. After that bit of running around, I suggest we adjourn at 6:55.
I second it. And happy holidays, happy New Year, everyone.
Yeah,
Yes.
happy holidays. Thank you all. We'll see you in the new year.
Bye,
Sounds
guys.
good. Bye-bye. Take care.
Take care. Bye-bye.